And I was very impressed at the clinical side of ICANotes. I thought that it captured all of the things that we did clinically with the patient in a very clear, succinct way. The thing that sticks to my mind was when assessing suicidal ideas, you could talk about ideas, intent, plan, support systems, all in one breath, in one sentence, which could all be captured most accurately with 2 clicks of buttons. And therefore, I thought to myself, if this is the most difficult part of the note, we could do it every time consistently in a very facile manner. And that's what led me to think that ICANotes would be the way I would go. Decided that I would grow into a multidisciplinary practice. My first concern was I did not want to invest in a lot of internet security and servers, and I wanted scalability so that people who come to work with me are able to integrate quickly into the electronic medical record side of the practice as well. So the practice began to have its own identity, a philosophy, but we wanted an instrument that would capture all of this in a fairly simple way. We created a number of buttons which would allow different people speaking the same language to express themselves clearly. So this kind of an innovative additional pieces that we can put in ICANotes attracted us very much towards your product. Really contributes in 2 ways. As I told you, one of the primary goals of providing access to care is to see the person for medications within 2 weeks. To be able to do this, I have a large practice with therapists who are licensed social workers or psychologists who are able to see the patient for an intake, for instance. Now I can build my note based on everything that they have already done and very quickly get to the psychiatric interview as an additional piece of service that the person who is seeking care needs. Because we write to the same chart, we are able to review, add, and embellish in any way necessary to make the clinical picture more accurate. And that is the reason we think that ICANotes has contributed directly to the model that we chose to have and has helped us in many ways, making our jobs easier to talk to each other. Not in direct conversation, but through the chart. And every time they open the chart, they're seeing the same note. The various little pieces in ICANotes, like a brief clinical message, allows us to sort of alert them to things that we think are important that was not in their original note, and they are able to then respond to me in a meaningful way. So this kind of an interactive use of an electronic medical record is something that appeals to me. We like the idea of using one program to do as many of the office functions as possible. We e-prescribe, we were one of the earliest adopters, as far as I know, of Doctor First. And when EPCS was offered, EPCS Gold, we took that on. And we've been very pleased with the fact that we are able to do everything in one chart, not have to write a prescription by hand, make sure we entered it into a program. I can tell you, as a fast growing practice, I've had quite a bit of turnover of front office staff. And we have never heard a complaint from the side of ICANotes that they couldn't train one more person. And I told you, between November 2010 and now, we have 15 new providers on board. All of them are able to call support. We know many of them by first name, so I guess we use them a lot, and we are pleased. I think by and large that is a strength of ICANotes.